Thank you all for coming here today. My presentation is divided uh, into session of introduction, healthcare system, the main challenges of healthcare system, purpose model, and finally uh, conclusion. First, introduction. Uh, Healthcare Internet of Things or the Internet of Medical Things is a turning point the deployment of information systems in the medical industry. This system play a major role in assessing patient health status and increasing their quality of life. IoT constantly after new tools, and these tools make up the integrated healthcare systems and help it with better patient care. These additive have discrete healthcare costs and improve treatment result. The main focus of this article is on machine learning methods that have attempted to improve various aspects of healthcare system in the IoT network. Predicting patient outcomes in IoT healthcare systems using machine learning has numerous advantages, including the following: disease prediction and prevention. Using machine learning algorithms, healthcare systems can detect and predict diseases patterns, enable preventive measure and early improvement. Healthcare system, they can all begin transaction of the healthcare systems regardless of their location, and the result of this transaction will be stored on the device and can be accessed by everyone on the integrated system. All transactions in IoT healthcare systems are stored in a general ledger. Smart healthcare play an important role in a healthcare program through embedding patient and their medication with sensors and actuators. For monitoring and tracking purpose, IoT is using by clinical care to monitoring the physiological status of a patient through sensors with collect their data, analyze it, and then send the information remotely to processing centers in order for them to take appropriate action. There are various ways of assessing IOMT, but generally the quality of care, remotely patient monitoring, and context awareness are their most important thing of consider. The automated medical data collect in IOMT decrease human error in the data collecting process, which can be harmful to the patient's health. It also increases diagnostic quality and promotes patient health. Remote patient monitoring. uh, Remote patient monitoring (RPM) is an important paradigm for many real-world applications. Real-time remote monitoring systems include an RPM unit and monitoring center. The sensor signals are transmitted to the appropriated medical care facility through a wireless local area network. As a result, this system provides information about the pattern, patient's health status, and offers immediate treatment, which reduces further complications and negative side effects. The system makes real-time patient monitoring possible in the healthcare sector. It helps input sensors with faster diagnosis and saving patient living. Context awareness. IoT can help healthcare professionals understand the sudden change with could affect the healthcare status of patients since it has the ability to track patients' health status and the status of the patient's physical environment. The various specialized sensors gather uh, meaningful data they help in understanding patient status either at the time of the hospitalization, at the patient's house, or any way the patients might be. Via gathering diverse data about the patient's physiological status through monitoring the walking, running, sleeping status, and blah blah, and patient's physical environment, such as the hotness, coldness, humidity levels, and the relation of the uh, aforementioned with one another. IOMT application aid in location the patient during a medical MGC and provide the type of medical intervention that can be performed to deal with the crisis. Healthcare networks in IoT. Various systems and devices must work in the context of IoT in order to improve the healthcare system's performance. The IoT healthcare network is one of the critical element in the wireless body area network. The efficient transfer of the data and general communication without the system is made possible by the VPN. IoT is made of network topology and platform. The main challenge of healthcare system. Healthcare system in IoT concept patients, clinics, and hospitals to an integrated system regardless of the user's physical location to coordinate healthcare services. There are many other issues to careful consider in research before the systems can become viable for mainstream use. Interoperability, standardization, and regulation. There are some standardization concerns about IoT. IoT manufacturer and user and healthcare providers all need operational standardization across all IoT fields. In the United States of America, the standardization of a wireless medical device requires a manual agency regulatory collaboration, including the Food and Drug Administration, FDA. The Center for Medical and Medical Service and the Federal Communication Commission. Heterogeneity. IoT healthcare application require a wide range of contextual data which are up to date through various heterogeneity sources. Interface and user capability. It is vital to consider other factors such as human capability and the extent to which users will accept program and to which a particular system supports a human interaction. Scalability. Expanding in a process to the entire hospital can ensure all patients will have access to medical service, receive status updates, and benefit from continuous monitoring. However, some patients, the limit battery life of sensors can negatively affect the life cycle of the devices. The battery life of an IoT devices will depend on varying factors such as the transmission range, the communication channel usage, overall time of use, and the complexity level of signal and data processing. Disadvantage, some IoT healthcare applications require the patient to constantly wear sensor or carry them around, which can become tedious and inconvenient to the user. Other studies, many scientists and researchers are working in the field considering the importance of the healthcare systems and their application in IoT.
We are a little bit short of time. Could you please go to proposed model a bit faster if possible, okay?
Yes. In this article, a model proposes to investigate machine learning methods in IoT-based healthcare systems using a scenario based on supervised learning on heart disease data. The heart disease prediction dataset is used in this article, which is available in the UCI standard dataset repository. This dataset includes 4 sets of data from patients collected as hospitals in 4 different regions. The available data set contain labels for patients with heart disease in various category and individual. The purpose approach initially forces on extracting important features in the dataset that have a higher correlation with the class labels of the training samples. Features that do not play a significant role in the patient's condition and cannot be useful for clustering should be removed from the other features. Such features are referred to as not correlate with the class labels. The correlation of features with the class label indicate which features can determine the class labels of the training samples and which features do not have much impact and determining the class labels of the samples. Removing such features allows the remaining features to provide a better representation of the entire feature set of the original data. In this article, after extracting the essential feature, the selected features are used as input in the preprocessing step for predicting heart patients. In the second step of this method, 5 different classification algorithms, including decision tree, nearest neighbors, neural network, naive Bayesian, and support vector mission and use. In this stage, the training process and predictive of correct and incorrect samples for each of the classification algorithms are examined.
Could you please go to conclusions? We are very good.
Finally, yes. In a rapidly evolving world, if not for all, for most people, remotely accessible interconnected devices which can analyze data have become necessary. To meet this demand, IoT has been created. The data that we collect through smart devices and smart hospitals can help the monitoring of patients in real time. This can help us learn more about disease medicine and vaccines. Several methods in predicting patients' health condition using machine learning were analyzed. Thank you very much.
Thank you very much.